The Minister for Health, Mr. Kweku Agyemang Manu, says the move to increase the quota for the intake of registered community nurses this year is to ensure equity in the training of all categories of health professionals. According to him, the decision is neither because of the reintroduction of the nurses' allowances nor the picketing at the ministry's premises by non-posted nurses as being speculated.
For some time now, the intake of students into the various nursing training institutions has been skewed towards few auxiliary staff. According to some of the trained nurses, the nurse assistant clinical is giving more attention than the critical health professionals whose work border more on preventive aspect of health delivery. For instance, in 2016, 8,046 clinical nurse assistants were enrolled, while only 3,013 of the preventive nurses who are the registered community nurses were enrolled. This trend prompted the ministry's decision to increase the intake of the community nurse from 817 in 2016 to 2,346 to ensure equity. The minister said the ministry is scaling up the CHIPS compound concept for purpose of educating communities to live in a clean environment in order to prevent diseases.
For the purpose of educating communities to live in a clean environment and reduce disease burden of our people, this informed the decision to reduce the auxiliary staff this year, 2017. The ministry and its collaborators had to increase the intake of registered community nurses from 817 in 2016 to 2,346. These registered community nurses work borders more on preventive than clinical.
The minister cautioned management of the nursing institutions on the enrollment of some students based on payment of bribes.
We have set up investigations machinery trying to uncover any such incidents. Anybody caught in this act will be dealt with ruthlessly. Any student caught to have admission upon paying any money will be sacked. And officers who might have facilitated the practice will also be sanctioned appropriately.
The Regional Director of Health, Dr. Samuel Kwashi, also outlined measures being put in place to reduce maternal and infant mortality.
What we need is an effective means of transferring and referring the patient from where she got the first attention to the next referral point.